Australia is having a heated debate about whether to legalise gay marriage. Now, it may sound a bit backward to some of you elsewhere like Canada or Britain where it's already legal, but we're a bit slow on this one. Now, I personally am not that fussed if it's made legal, but do worry that it will embolden some forces of the identity left, especially those that have always seen the heterosexual family as evil, the source of patriarchal oppression. They're there, I can assure you. Now, what's been interesting to me as a psychiatrist, though, is how some supporters from my profession have used mental health to encourage a yes vote. A bunch of mental health organisations, led by some of the country's most prominent psychiatrists, have come out saying, if you don't vote yes, gay youth are likely to commit suicide. They cite research showing gay youth are twice as likely to experience serious mental illness. Now, the same leaders have criticised even having a debate, arguing it would cause too much psychological harm to gays. Now, this is the bit that's really annoyed me, how many of my medical colleagues are becoming white coat allies of identity politics, often using questionable research to support them. Now, if applied historically, we would have had debates giving women or minorities the vote, for they were all at some stage deemed to be less robust than the white male. Imagine telling Martin Luther King to tone down his speeches because they invite some sort of blowback for fragile black people. Now, these interventions, they're basically a corruption of the Hippocratic Oath, first do no harm. It was never meant to be applied to the idea of psychological harm. I mean, that concept didn't even exist back in ancient Greece. Now, while the doctors' groups, they try and link their ideas to science, often unconvincingly, they forget they're responding to currents in the zeitgeist, much of which have little to do with science. This is where they become white-coated allies in the promotion of identity politics. Now, we live in a time when the public proclamation of pain confers status and allows the extraction of privilege. The gay marriage debate here illustrates this clearly, because both sides compete over which supporters are more maligned. Now, the last century, we've seen huge changes in our culture, particularly in the Western world. You know, life's mainly about how we can be fulfilled as individuals. Now, collective groups like families, communities, church, they're all much weaker than they've ever been. Now, we've gone from having characters with their moral connotations to having personalities. Now, all these trends have contributed to emotional distress being processed individually. We also use the language of psychology to make sense of our lives. Now, this decline of, say, a moral language is also why the church is a bit more stigmatised and why many health groups are intervening in debates like this one, marriage as addiction, or also addiction, which previously had more moral connotations. Now, the groups that do it entirely on the grounds of reducing harm, often at the expense of any other value. For example, I've never seen a public health study attempting to measure the social benefits of alcohol. Now, when combined with what the notion of concept creep, and this really just the weakening in the measures of the terms like trauma, abuse, prejudice, violence. Now, when you combine it with that, it's not a surprise that we're so sensitive to the notion of psychological harm. Now, more than that, we're also likely to blame it on the outside world. Now, this is where the current gay marriage debate in Australia shows all of these trends, quite clearly. Now, doctors have always had a really strong moral authority. They've been sort of like secular priests. But as the clergy's prestige weakens, leading health groups in Australia are hitching their wagon to kind of powerful alternative moral currents, but confusing them with science. I'm Tanvir Ahmed. If you like this video, subscribe to Rebel Media.